I'm finding that organizations that have a clear value proposition tied to some aspect of efficiency or efficiency growth, essentially, are getting a good solid hearing at the organizations. And then they can prove that out. And there's an acceptance for it. If the ROI is under a year, it's yes, let's go, let's start. If it's 2 years, there's a conversation that needs to happen. If it's 3 years, that goes through the normal long conversations and gyrations it normally does in a health system, which for startups like yours has to drive you nuts. Because I've talked to a lot of people, they're just like, man, the sales cycles are still so long in healthcare. Like you have to,
Yeah.
just when you thought we're ready to go, it's like, well, could you come in and talk to this group of people one more time? And you're like, okay, yeah, we'll talk to them.
Absolutely. I'll be there tomorrow. Yeah, I think for us, it really has been a journey in learning to tell that hard ROI story, because I think there's so much about what a robot like Moxie provides that, frankly, a number of CFOs at hospitals we talk to say, well, that's just a soft ROI. And one of the bigger ones is the things that we hear from nursing leaders and pharmacy leaders is the joy that the robot brings to the workplace, and the ability to offload some of the tasks that Moxie takes on really does increases people's job satisfaction. They are no longer doing some of the grunt work that they were asked to be doing before. And so unless you can, on top of that, also point to a cost savings or cost avoidance or all of those steps that the robot is doing that people aren't doing, means that you can operate your pharmacy or your lab with, you can do more with less, is people are looking for both sides of that coin, for sure.
I've seen your robots are really well designed. They look really fun. I don't know.
Yeah.
I don't know if they are fun. Can they play cards or anything like that? No, they're
We
a very
don't.
specific robot.
We actually tell people, like, specifically, Moxie's not going to stop and chat with you. Moxie's got some work to do.
At a children's hospital, I would think they're fun to have around.
Yeah. So at a children's hospital, we do sometimes get tasks for the robot that are specifically distraction visits or wellness visits. We haven't done it yet, but there's one medical director that wants to have the robot scheduled for some of the ambulatory units to do like around, just take laps around the unit and convince the kids to get up out of their bed and walk around.